So President Cyril Ramaphosa says the National Coronavirus Command Council will meet next week to discuss measures to deal with the Omicron subvariant we've been discussing. Wits University Emeritus Professor of Virology and former NICD Director Professor Barry Schoub is with us tonight to talk more about the situation. A very good evening to you, sir. Grateful for your time. So it's generated a lot of conversation since confirmation that indeed this cracking subvariant is already in circulation in South Africa. What then should be top of mind for the Command Council ahead of the meeting?
Yes, good evening to Makila and good evening to the viewers. You know, I think we just need to put this all into perspective. You know, we have had the Omicron variant for several months now, and this is a subvariant of Omicron. Omicron is a very changeable virus, and this is one of these subvariants. So it's not too surprising. It's not too, certainly not alarming. It is. One needs to kind of take cognizance of it, and one needs to kind of be vigilant. But I don't think there's any cause for any specific public health measures at this stage. We need to monitor the situation. But as I say, we have had Omicron on the one hand. Also, we do have a very high level of immunity in the population, which has dealt pretty effectively with Omicron up to now. But I think what we need to really focus on is on our vulnerable population. The vulnerable population are the elderly, and also those who've got underlying medical conditions which make them more vulnerable to the side effects or to the more severe effects of the virus infection. And these groups of individuals must be vaccinated, must keep up with their vaccination schedules, and must ensure that they are fully vaccinated, that they've had all the boosters. I think that's the main take-home lesson of this whole thing. So we need to be wary about it, and we need to ensure that those that are vulnerable are protected by being vaccinated.
Right. Does it mean, Professor, that those who are vulnerable will have to take a booster, get a booster, every time there's a new highly transmissible variant or subvariant?
No, I don't think every time, because the vaccine does have a certain durability. It lasts for a certain number of months, anything from 6 to 9 months. So I think those people that haven't had their booster within the last 6 months, I think should ensure that they get it. But I don't think that every time there's a new subvariant that they need to take a booster. But I think we need to distinguish between a subvariant and a variant. Omicron is a variant as Beta in the past was and Delta in the past was. So we are always on the lookout that there's not a new variant that arises, because that could change the picture. I think it's unlikely. It's an unlikely scenario, but I think we need to be concerned about it because we want to pick it up as soon as possible. And fortunately, we've learned a lot of lessons. We do have a good surveillance systems now, which are geared to picking up new variants at the earliest possible time. That might change the picture. But the subvariant of Omicron, probably not too concerning at the moment.
Could a subvariant give birth to a variant?
Yeah, the subvariants are usually the kind of changeability of the variants. In other words, the variant is the kind of the more kind of changed virus, to put it that way. The subvariants are kind of an offshoots of the variants. And usually, because one has had experience of the variants, one develops a certain amount of immunity to the subvariants as well. This particular subvariant has, as I think one of your interviewees mentioned earlier, has got a problem because it's mutated in a very sensitive area, which makes the virus more sticky, as it were. It sticks to the binding site on the cell, and therefore it has a very much greater growth potential, and therefore it's more transmissible. That's the only real characteristic of this particular subvariant. But I must stress there's no evidence as yet that it causes any more severe disease. It just spreads more rapidly.
All things considered then, even for vulnerable groups, how worried should those people be in terms of a new subvariant emerging, and how closely do they need to watch the gap between such an emergence and when they were last vaccinated or given a booster? Because in the last 2 months, I'm sure you recall the conversation about whether it was time to move people to a third, fourth shot, even in some cases.
Yeah. Look, I think the vulnerables, the vulnerable groups that you mentioned earlier, should get a fourth booster, a fourth dose. It would be a second boost, but a fourth dose. And I think they would be reasonably well protected against severe disease. Not necessarily against the more milder forms of the infection, but certainly against the more severe disease. Look, I think there's also the common sense that, people that are in the vulnerable groups should try and avoid coming into as far as possible, as far as practical, into closed environments and try and keep a social distance as far as possible, and wear a mask in those kind of situations if they are in the vulnerable groups.
But in terms of masking and some of the rules that we were all used to 2 years ago, it was said and it was raised as a concern at the end of the formal lockdown and enforced wearing of masks, for instance, that once we had taken them off in the main, it would be harder to get them back on people's faces.
Yeah.
Do you think that's going to be a challenge still?
I think it will be a bit of a challenge, but I think this is where the kind of promotional messages need to go out. That particularly, look, I think the kind of general public, and particularly to try and get to be as much possibly outdoors and have outdoor functions, because we know that this virus is very poorly spread in an outdoor environment. So it really is the common sense kind of measures that in an indoor environment, poor ventilation, close contact, crowded conditions, and vulnerability, I think in those situations, one should definitely encourage vulnerable people to wear a mask. The problem, of course, people are now in a way a bit embarrassed to wear a mask. And I think that we need to kind of do a bit of social engineering and try and educate the public that there are high-risk situations, and those high-risk situations do demand measures such as mask wearing in those kind of situations.
There will also be those people who say, well, we've done well without masks for all of 2022 and have weathered the worst. Yes, we know that there has been still a number of people dying and being infected with COVID-19, but people say in the main that, well, they've done pretty well, survived without even a booster in some cases. How much weight does that argument hold for the broader population?
Yeah, I think for the broader population at the moment, where we are in South Africa at the moment, we've got a very high level of immunity. The subvariants of Omicron probably do not cause severe disease in that background in the majority of the population. So I think we need to kind of counter the more alarmist messages which have come out about this XBB 1.5. It is a variant, just a big correction. It's a subvariant of Omicron, one that we're used to, and it no cause particular alarm. What I'm saying is that there is coronavirus around, there is COVID around, there are some people that are still being hospitalized, and it's really the message to the vulnerable, particularly to ensure that they are vaccinated.
Professor Barry Schoub, good to speak to you, sir. Thank you very much for your time tonight.